Clay Travis, Buck Sexton Show. Appreciate all of you hanging out with us. We're joined now by Avik Roy, president of the Foundation for Research on Equal Opportunity, policy editor at Forbes. He's done fantastic work for a variety of different issues. I think the last time I saw you, Avik, was down last year in Austin for the Alabama-Texas game, which was a lot of fun. And I think you're still in Austin where your organization is based. But you're a big Michigan Wolverine fan. So before we dive into healthcare policy issues, how would you assess? We just got a brand new affiliate in Detroit, 9:10 a.m. We're blowing up all over the state of Michigan. How would you assess the University of Michigan's start to the season?
Well, those Lions fans are going nuts in Detroit. That's been the hot topic out there. But yeah, I think so far the non-conference schedule, I can't say that Michigan has overperformed. There's been, I think, a lot of lack of chemistry on the offensive line. The perimeter blocking in the run game hasn't been great, whether it's the tight ends or particularly the wide receivers. They did a little bit better on that against Bowling Green, so that was a good sign. Corum seemed to get his legs back. But then J.J. McCarthy had a couple of brain-dead throws, and very unlike him, was flashbacks to TCU. So they obviously have to get that cleaned up. But they've got all the pieces. Look, they have a great offensive line in theory. They have two great running backs, first-round caliber running backs. They have a first-round caliber quarterback. They have fast receivers. They have great tight ends. On defense, their defensive line is awesome, Georgia level perhaps, and their secondary is banged up a little bit, but looking pretty good. So they've got all the pieces to go very far, but they just have to put it all together, and they haven't done that yet. And Rutgers next week is going to be an underrated test because Rutgers is looking pretty good.
So, Avik, I'm going to be the nerd here, and I'm going to ask you about healthcare policy if I can. So, you guys, I know you guys are having fun.
I was thinking of you all with that Alabama-Texas game the week before last, because that would have been a fun one to see. I bet you guys, if you were there, had a great time.
That was a phenomenal. It was a phenomenal game, especially because it was almost such a big upset. But a lot of people out there have too much that they're paying for healthcare premiums, healthcare visits across the board. I pulled this up right beforehand, Avik, and I know you're a healthcare policy expert, have been for many years. That affordability of healthcare, when you average it between Democrat and Republican in most of the major polls that you can pull for the last, well, probably a long time, but certainly the last 12 months, affordability of healthcare is a top 2 or 3 issue in poll after poll for people right now. Usually just behind inflation and jobs. Those are the ones that it's inflation, jobs, and then affordability of healthcare pops up right alongside them. I thought Obamacare was supposed to fix all that. What happened? How are things getting more expensive, Avik?
Yeah, they called it the Affordable Care Act, right? And healthcare. In fact, Obama, you'll remember this, Buck, and Clay, you might as well. In 2008, when Obama was campaigning for president, he promised repeatedly on the campaign trail, and I've got the video to prove it, that his plan would reduce the average family's health care premiums by $2,500 per year. He kept repeating that promise, which came out of a random, look at back of the envelope estimate from a couple of Harvard professors that were just kind of guessing, basically. But he ran with that, and instead, healthcare premiums for the average consumer, average family of 4 went up by $2,500 for a family of 4 in year one, and it's only gotten worse over time. And now we have to say that healthcare was expensive before Obamacare. Its prices were growing faster than inflation before Obamacare. Obamacare made it worse. If you had to buy insurance on your own, so if you weren't getting it from your employer, you weren't getting it from the government, you were shopping for it in the old, what was called the individual market for health insurance. It used to be a lot cheaper. Under Obamacare, those premiums doubled and tripled, and they've continued to go up.
So, Avik, this is part and parcel of, I think, a failure of the American healthcare system. And you tell me if I'm wrong here, but the data that I have seen suggests that if we had half as much medical treatment, there would be no change really in the amount of years of average life that are added, right? In other words, the quality of the healthcare results would not change with half of the amount of healthcare spending. Do you buy that? Or do you think that's an exaggerated analysis of our current system?
I do buy that there's stuff we do at the end of life that, to kind of be heroes that may not make much of a difference. But the problem is, it's really hard. It's easy to look at that in hindsight and say, "Oh, we shouldn't have done that, or we shouldn't have done that. That didn't work." But you don't know until you try it, right? And who's going to tell that 75-year-old or that 80-year-old, don't do that. Don't do that thing that might save my life, right? So that's a hard thing to solve. But what you can solve, and what's clearly true in the United States, is that unit price of every piece of healthcare we deliver to people is way higher here. Most people know that what you pay for prescription drugs in the US is 2 to 5x what it is in other countries. That's true of hospital care too. The average hospital stay in the US, we actually are very good at getting people out of the hospital. A lot of the surgeries, when I tore my Achilles 5 years or 7 years ago, it was done in a day. I was in and out of the hospital in a day. So in a lot of other countries, that's a 5-day operation, or you're in the hospital for 7 days. So we're really good at getting people in and out of the hospital, which would save a lot of money. The problem is each day we spend in an American hospital costs 5 times five times as much as it does in Switzerland or Germany or Scandinavia or any other wealthy country that you can think of. So the problem in America is that the price of the health care that we deliver is way higher than it is elsewhere. And the reason for that is because we've made 80 years of policy mistakes at the federal level that have incentivized drug companies and hospitals and doctors and lab test companies to charge you more and more every year, because you don't pay directly for those services. You think you bought insurance, your employer bought it for you, and you have no sense of what anything costs or what you paid for anything because you didn't directly pay for it.
So what are the parties offering right now for Democrat, Republican 2024 healthcare solutions? One thing I asked Clay about, I was talking about this off air, it's like, does anyone even have a healthcare plan that they're talking about right now? What is it? And what should it be, maybe more importantly?
Yeah, so far, not much. So Biden hasn't really talked about much on healthcare other than, continuing to bail out Obamacare with more subsidies. They did pass the Inflation Reduction Act, Medicare prescription drug price negotiation provisions last year, which I actually think is reasonably good policy, and I can get into that if you want. So I'm differ from a lot of Republicans on that particular piece. I think it's actually the pro-free market thing to do, to let Medicare negotiate drug prices to a limited degree. But if you talk to the Republican field, there's not a lot at all. Now that could change. It's still early in the campaign. It's possible that you'll see some of the candidates in the Republican field talk about healthcare more as the campaign goes along. But as of now, we don't have a lot of details from the candidates. The closest we've gotten, I think, is Nikki Haley, who said at the last debate that she's very concerned about the federal deficit and debt, and flagged healthcare as one of the causes of that. But she didn't get into a lot of details as to what her plan would be.
So how do we fix it?
Well, at my think tank, the Foundation for Research on Equal Opportunity, we've talked about how to fix it for a long time. In fact, there's a bill that's been introduced in Congress in both the House and the Senate based on our work, called the Fair Care Act. And it's the main sponsors in the House are a congressman from Arkansas named Bruce Westerman and one from Indiana named Jim Banks. And then in the Senate, it's an Indiana senator named Mike Braun. And basically, the idea of the Fair Care Act is pretty simple. Let's make healthcare less expensive by unleashing the forces of competition and innovation so that people are competing for your business as a consumer. Let's make sure that we're only subsidizing people who really need the help. So one of the real things that we do that's a mistake in America is you and I pay taxes, and all your listeners pay taxes, so that Warren Buffett and Mitt Romney can get government subsidized healthcare. Why is that? Why don't we actually subsidize healthcare only for the people who truly struggle to afford it, whether it's because they're vulnerable, they're sick, or they're low income, or even middle income people who just can't afford it? And let's stop subsidizing healthcare for rich people. If we just stopped subsidizing healthcare for rich people and allowed people to buy the insurance they want to buy instead of having it forced upon them by their employer or the government, you'd unleash enormous synergies in terms of savings. Because at the end of the day, what we all know about everything in life is that if you're spending your own money, you're going to be a lot more careful about how you spend it. But if somebody else is spending somebody else's money on your behalf, no one's going to care how it's spent. And that's what allows everyone in the healthcare industry to raise prices on you. So the left-wing solution to that is to have the government run it even more. right? Have price controls, restrict access to expensive things, all the things that you see in all those single-payer countries. But there's a free market way to do this, which is you should control the healthcare dollars that are spent on your behalf. If you spend the money, just like on everything else you do in life, you're going to spend it wisely. And yes, let's make sure that we help the people who truly, truly need the help. But that's a fraction of who we're subsidizing today.
Avik, easy question, example of that. I've had 3 kids. Fortunately, they have all had relatively smooth deliveries. We went and toured all of the places in Nashville where you have children, hospitals. None of them could tell me what it was going to cost. They could tell me that they were going to have Wi-Fi. They could tell me that they were going to have bamboo floors. They could tell me that we were going to have private waiting rooms. None of them could tell me what having a baby was going to cost. And I couldn't get past that when you would tour. And this is discretionary, right? I could choose to go to this hospital or that hospital. In every other facet, there would be price competition. They couldn't even tell me the cost.
Right. And there's no law preventing them from telling you the cost. They just have no incentive to do so because of all the
crazy is that?
Distortions. It's crazy.
Avik, if you showed up to buy a car and you just walked onto the car lot and no one told you what a car cost, it would be madness, right? That's basically what happens oftentimes with healthcare, even when it's a discretionary time. It's not like this was an emergency. You can pick where you're going.
Absolutely. And so, one of the things I tell conservatives and Republicans all the time is you hear some people say, it's not the federal government's job to fix healthcare and make it more affordable for you. I understand that sentiment, but what people need to understand is the reason healthcare is so stupid and expensive and opaque to the patient and the consumer is because the federal government has been messing it up for 80 years. And so it is important for members of Congress and senators to fix the things that the federal government has messed up, that Congress has messed up about healthcare for 80 years. And price transparency is part of it, not just price transparency so you as a patient or as a parent can know how much it's going to cost you to get your baby delivered. But one of the things that the Trump administration did that I think is a really positive development that's going to improve healthcare over the next several years is the Trump administration passed a series of regulations that force insurers and hospitals to be transparent about the prices they negotiate with each other. So if Blue Cross or United or Aetna or whichever insurance plan you have has negotiated a certain price for that delivery of a baby at a particular hospital, now that has to be disclosed to the public. Now, the hospitals have been dragging their feet in disclosing that data. And that's an area where the government has to be more, has to do more to enforce the transparency rules. But once you have that data out there, then as an employer, you can see whether or not your insurer has done a good job of negotiating on your behalf. Because sometimes insurers are lazy. They don't actually do a good job of negotiating on your behalf. Because actually, if healthcare prices are higher, and their operating margin is 5% of a bigger number, they make more money. They actually make more money if healthcare is more expensive in a paradoxical way. So as a business or as a consumer or as an individual, what you need to know is whether those insurers are doing a good job negotiating on your behalf. And one way for you to do that is to pay for the premium yourself instead of having someone pay the premium for you. So another big reform and part of the Fair Care Act is instead of what we do now, which is given a big tax break to the employer, if the employer buys health insurance for you, why not give the money to you to buy the health insurance that you want to buy? Then you really unleash these forces of competition just like they exist in other parts of the economy. And that's what we got to do if we want to not have a socialized system. And I think the thing that Republicans do that concerns me is they're so scarred by the experience of 2017, not failing to repeal and replace Obamacare in 2017, that they just don't want to touch it. They're like, you know what? We tried doing healthcare in 2017. We got our fingers burned on the stove. We don't want to deal with it again. And that's a mistake because healthcare keeps getting more expensive. Just as you said, the polls show that it's a top concern of voters. And if Republicans and conservatives don't have a reform that's going to work, then people are going to turn to Democrats. And we know what Democrats are going to support. They're going to support public options. They're going to support single payer. They're going to support removing even further the role of the private sector in healthcare.
Avik Roy, president of the Foundation for Research on Equal Opportunity. Avik, always a pleasure, sir. Thanks for being here.
Great to see you both.